All right, sorry, somebody messaged me. Okay, so yes, so we'll resume with the third session. This is Dr. Vivian B. Pender. She is the president-elect of the American Psychiatric Association, clinical professor of psychiatry at Cornell Medical College, and training and supervising psychoanalyst at Columbia University. She is also the special advisor to the APA on the UN, as well as the main representative to the UN International Psychoanalytic Association. Dr. Pender will be speaking on human trafficking, training healthcare. Thank you, and I pass the floor over to you, Dr. Pender.
Thank you so much. Thank you, Tammy. It's really an honor and a pleasure to be here. And thank you for sharing the weekend with me. So I'm going to be talking about human trafficking. This is a topic that I learned about at the United Nations when I heard people, non-governmental organizations, talking about just how much trafficking there really is around the world, but also in the US. So let's see. The next slide will be, okay, so I will give you some definitions, some statistics and laws, and then I'm going to show a small video of kind of how it began, how I took my experience and what I learned about trafficking at the UN, how I took that to the medical school at Cornell and organized a conference. And I'm going to give you a little video clip of that conference about 5 years ago. And then we'll talk about how it relates to psychiatry. So what is human trafficking? If we were in a room, what I usually do when I give like a grand rounds or something, I have people raise their hand and see what people know about it, because they may know nothing about it. They may say, I've never heard of it. I mean, it has been in the news. So I think most people do know something about it, but it has a very legal, formal definition. And that is, so it's the act of harboring, recruiting, transporting, transferring, or receiving a person by the means of force, fraud, or coercion for the purpose of sexual or labor exploitation. There are other kinds of trafficking, but these are the main ones. So it's kind of modern day slavery. And I'm going to show you now the video of a conference we did, as I said, at Cornell. And it includes a survivor who is the second speaker. And she gives her story. We had about seven or eight speakers, a psychoanalyst, a survivor, an adult psychiatrist, that was me, a child psychiatrist, somebody from the OBGYN department who ran a survivor clinic at Cornell. We had somebody from the FBI, Special Agent Anthony. We had a congresswoman, the dean of the medical school, and and the last speaker was somebody from the community who has an advocacy organization to combat trafficking. So here it is. It runs about 10 to 15 minutes, and then I'll be back. Can you hear it? It's good.
Yep, we can hear it.
What do diamonds, bricks, the Super Bowl, high school dropouts, pornography, exotic luxury, vacation hotels around the world, prostitution, coffee, sugar. What do these things have in common? I suspect that everyone here and listening today has some connection to at least a few of these. Before we can consider how to contribute to solutions to stop human trafficking and make ourselves available to help those victims recover from this kind of trauma, we must ask what part of each of us play, what responsibility do each of us have?
So without knowing all of that backstory, it's hard to answer some of the questions that I was asked. Like what was I thinking in the hotel room? Why didn't I run away on the streets or in the hotel? So what was I thinking in the motel room? It wasn't very much, except that I was very disappointed. I thought, oh my God, she just wants to use me just like everyone else. Why didn't I run away at the motel? The only thing I can say there is that I already was running away. My decision to run away was very serious. I packed a bag with my favorite pairs of jeans, my favorite music, and pictures of my friends. I had run away before then, but it was always in response to some sort of argument with my parents, and I would just stay overnight somewhere. This was planned out. I didn't tell my friends where I was going, and I was serious. I was going to go to LA and show everyone up that I was going to be somebody. Why didn't I run away when I was on the street? Again, it's hard to understand the answer to this question without hearing all that backstory. The truth is, as I started to work in Atlantic City, initially against my will, I actually began to feel empowered by prostitution. Because before that, I would walk into a room and not know what was going to happen. Or I would engage in sex with an older guy and not really know what it meant. Did this mean I was in a relationship with them? Did this mean it was going to go somewhere? Now I knew it. Everything was on the table. I was going to walk into a room, was going to have sex, and I was going to get paid for it, and that money was going to help me get to Los Angeles and become somebody. So I actually started to look at the people who lured me away from home and tricked me into running away as my friends. I actually started to view this as a viable option or alternative to high school.
So how do we get cases? Well, we get them through a number of different ways. We get them through random complaints, neighbor may see something, hear something. We get them through victims, which is very, very rare. It's very rare that a victim will come forward and say that, hey, I am a victim and I need help, but it does happen. We get cases through non-governmental organizations like Sanctuary for Families, St. Horizons, Restore, GEMS. We get complaints from them as well.
From a law enforcement perspective, you can catch someone with a kilo of cocaine. You can catch someone with a gun. When you see someone with a child or a woman, how do you know that they're involved in human trafficking? It's much harder to see the crime, especially because the crime is done in a way that involves fraud. Nobody goes to no John goes to a place where there is a prostitute and expects her to be crying and saying, I'm being held against my will, I'm coerced. In order for her not to get beat up, in order for her to continue to survive, she has to act like that John is the most wonderful person she's ever met. And not only that, but she has to almost make him believe that she would do it if she wasn't being paid for it. That's the mystique of it. I often feel like I carry every victim on my shoulder because each one of them has suffered things that no one in this country should suffer. We can't have a country that allows slavery. We've said that hundreds of years ago. And yet today, when you walk out of here, when you walk out of the practices, wherever you go, you're going to be seeing people who are still enslaved. And I urge you to open your eyes, take a look, and please help us.
Human trafficking is one of the most monstrous, pervasive, and under-penalized crimes on the planet. And it's carried out by some of the most evil, morally bankrupt people on the planet. People who destroy the lives of innocent girls, women, and boys, and make their existences living hell. I want to really go into one of the questions that keeps coming up because it's very pertinent to what's happening. I have a great speech, but I'm not going to give that speech. You know, you keep saying, why don't they go after the pimps, the traffickers, and the Johns? And I have been working on this issue since 1999. And I want to tell you how horrible it's been. It was first brought to my attention by a not-for-profit called Equality Now, that was then headed by a woman who's become a very good friend of mine, Jessica Newworth. And she came to see me and she said, Congresswoman, do you know that one of the biggest prostitution rings and destruction of young girls is taking place in your Queens community? I said, no, tell me about it. And there was an organization called Big Apple Tours that was literally on the internet. They had brochures, they had promotions, and their promotion said,
Ooh, Dr. Pender, the video's audio has gone out, I believe.
let's go have fun. So I immediately, and she was trying to stop this. So I immediately wrote Janet Marino. I went to see the DA, DA Brown and other DAs. And Janet Marino wrote back, there's nothing we can do about it because it's not really a crime. I said, how is it not really a crime? It's a crime in our country. It's a crime in their countries. Why is it not a crime?
Encourage you to take what you learned today, continue to draw attention to the political problem that we're facing. Weill Cornell is committed to raising awareness about human trafficking, and that you join us in this endeavor. So thank you very much for being here.
So as I alluded to a little bit, the approach of the clinic is really patient-oriented. Of course, the visits are confidential. And I think what is really important to a lot of the survivors is that they're unaffiliated with the social services group that they're getting their care from. So there may be things that the survivors want to talk about that they haven't necessarily brought up yet with their social worker or with the leaders of the group home in which they're living, or with their lawyer, and that's fine. But I am not affiliated with any of those organizations where they're already seeking care. We start the visit with setting their goals and setting what they describe as their chief concern. These women don't really come in with a chief complaint the way we think of it in medicine. It's not quite so specific for them. It's more that they want to know what their health status is at this point. For a lot of them, they have not been to see a doctor or for a comprehensive exam for the whole time that they've been in life. And so this is their chance to kind of talk about everything, and we try and pinpoint the major issues or questions that they may have. And then we do a full history and physical, and this is really guided by the patient. I try and do it more as an interview and storytelling, and less, now we're going to do past medical, now we're going to do past surgical, now, because I don't think that they necessarily think of their medical history in those terms. And I think I actually get a lot more specific details and a lot more truth into how they live their lives and what their health risks may be when we tell it as a narrative, as opposed to having them try and find the medical language to fit into the boxes that I'm used to discussing with patients.
So what is the mental status of the client? Well, I've tried to delve into this with some of my clinical experience. So as we know, when a person can use a lot of fantasy, and we call this polymorphous perverse fantasies, which is normal in children and in adults. So you can have as many fantasies as you want, but we don't usually act on those fantasies. And so in some people, fantasy can be used to mitigate behavior, mitigate the need to act on those fantasies. For other people, behavior with a real person is necessary to have the fantasy and feelings, because remember, some of the buyers have also come from very traumatic backgrounds, and this is the only way that they can experience sex. So some of them are unable to symbolize or use words. for their feelings. And then another category is the men who have such perverse or violent fantasies that they can only behave this way with a depersonalized or unreal object.
The young girls maintain the secret out of fear, shame, and intimidation. And for the rest of us, we resist it as we are traumatized ourselves when exposed to and dealing with the details of the enslavement of these young girls.
Consequent temporarily effective coping mechanisms such as passivity, denial, numbing, and dissociation ultimately yield to maladaptive patterns and characterologic mechanisms of defense that impair development and consign these girls to a future of bondage. The seeking for someone who will care, a daddy, a term that pimp often requires her to use, or a family. This is a need that is readily appreciated by the perpetrator.
That brings me to the Super Bowl. This was one of the pieces of information that shook me up a lot. The idea, I think it was Anthony in the FBI speaking at one of these meetings who said that these big mass organizations, concerts, political conventions, and big athletic events like the Super Bowl are occasions of a great deal of trafficking. I had the misfortune to put this out on the listserv of one of my professional organizations, and you would think that I had actually ripped apart the American flag. People's reaction was, Super Bowl, football, but those are our guys. You can't do that. And I was actually shocked that this was an intolerable idea in this discussion, that the Super Bowl could be the place of this level of slavery. But it's a sign of slavery. How are we going to make sense of this? So I'm a baseball fan, not a football fan, so I'm out to find things wrong with football. And there's of course an enormous movement at the moment, I promise, to pay attention to the injuries to football players. And there has been an absolute apathy and refusal for owners and for fans to be able to think about that.
So in New York State, until a few weeks ago, if no child, as you know, can consent to sex if she's 17 or under, but if you gave her a $20 bill, then she was criminalized, well, prior to the Safe Harbor Act. And so we aligned the penalties for statutory rapists to the sex traffickers, to the buyers of sex of minors. Sex trafficking is an affirmative defense to prostitution, which is critically important for the advocates. And you can read on with civil remedies and developing protocols to increase law enforcement's awareness. But more importantly, in the New York Penal Code, the term prostitute is the only term that defines a quote unquote criminal. You don't say a robber, you don't say a thief, you don't say a murderer, but somehow you say prostitute. And so a highly stigmatizing word. And so we are thrilled to announce that now it will be replaced for person for prostitution. When people tell me that women choose this life, I can't help but laugh. Do they know how many women like me have tried to escape but have been beaten back black and blue when they are caught? To the men who buy us, we are like meat. To everyone else in society, we simply do not exist. So the reason why this code is so powerful is that we are now at the cusp of seeing, and here are a few survivor-led organizations, survivors who are not just telling their stories anymore, but survivors who are starting their own organizations, who are at the table with policymakers and legislators, who are really informing us anyone who does grassroots activism, you know that the solutions are at the grassroots. They are at the fingertips of the people who have suffered these abuses. And so it is critical for us to honor survivors' voices, to ensure that they do have all of the resources to help us really develop and implement the best policies that we can on exploitation in the sex trade.
Okay. Thank you very much. I hope that that video kind of gave you an overview of what we did in about 5 years ago. And so that's kind of where I started, or we started, in the healthcare system, in the medical school. And I'll show you in a little bit where we have wound up. So there are laws against this kind of activity. It's, you know, we had to include the FBI and the U.S. Attorney, and because that's been the domain of as you heard Taina say, of the prostitute, which was the equivalent of a criminal. So there are national laws, and the last one in 2018 has to do with online sex trafficking that is readily available. The global statistics are such that, so the world population is almost 8 billion, right? And 760 million adults are illiterate, making them unable to read or write. They have no education. 72 million children worldwide receive no primary education. And most of them are in sub-Saharan Africa, and a lot of the internationally trafficked victims come from that area of the world. And more girls than boys are uneducated. And of course, there are child soldiers. There have been for a long time, and there still are in some areas of the world where conflicts are going on. This is a picture of 2 children who are being labor trafficked. And then there's forced early marriage. Now, you wouldn't think that this would occur in the US, but it does. Child marriage is legal in about 46 states. They have to have parental permission. And but in some states, there's no minimum age, and they either have parental permission or sometimes a judge can decide. And this we consider a form of trafficking. Some of these girls are 8 years old. I don't want to overlook that although most of the victims who are trafficked are girls, that there are boys who are also trafficked or sexually abused in some way. And this is a very underreported kind of epidemic. It's more hidden and silent, but when it does occur, there are lifelong effects. So, and I'm bringing this all up because if we don't ask, if we're not aware, then we think that it doesn't exist, and it's perpetuated. So in 2019, the National Human Trafficking Resource Hotline and the Polaris Project reported that there were 22,000, this is in the US now, 22,000 victims, identified victims and survivors. The average, and I want you to skip down to the fifth bullet point, the average age of entry into the sex trade is 12 to 17 years old. And a lot of the studies that I saw said 12 to 14 years old. So these are very young girls who, like Holly said in that video, she was, I think she was about 14 when she ran away from home. So 2/3, I know the map is a little fuzzy, but for you to know that 2/3 of the victims in the US, victims of trafficking, are US citizens. So, you know, they don't have to travel across borders. They don't even have to travel across straight lines. It can be a girl who actually goes to school every day on the weekdays, and then is trafficked by a neighbor, a so-called boyfriend, and sometimes even relatives traffic her on weekends, or him. During COVID, this just has been even worse because of the lockdown and lack of employment. There has been more sexual violence, more domestic violence, and children are believed to be at increased risk. We don't have any statistics right now on that. And under the previous administration, US administration, there was a decrease in T visas. So T visa, it's specifically for trafficking. If you can prove that you're being trafficked, or someone can prove it, you can get a T visa, and that, you know, that's for international people who are trafficked here. So hopefully this current administration will restore the availability of T visas for internationally trafficked people. I hope you all recognize Jeffrey Epstein, who ran just a massive trafficking business, and allegedly here he is with Prince Andrew, the girl he's with in a helicopter is 14 years old. This was a spa, and that was in Jupiter, Florida, where the NFL New England Patriots owner was caught and charged with soliciting prostitution. So I you know, in view of what happened recently in Atlanta, I don't mean to imply that massage parlors are all like this, but this one was, and what happened was they closed it down for about 3 months, and Robert Kraft paid a fine, and then they were back up in business, and it continued. So something about the victims, which is really important. They are usually, most, I would say almost 100%, have experienced some kind of sexual abuse as children. So I can't emphasize this enough, because that is something that's preventable. Sexual abuse of children is preventable. And if it were prevented, it would eliminate a whole raft of psychiatric disorders, personality disorders, traumatic disorders, and possibly trafficking. So it goes from sexual abuse as a child, usually with somebody who is known to the child, to commercial sexual exploitation, and then sex trafficking. Who is vulnerable? Well, as I said, people who have experienced some abuse or neglect as a child, the foster care, juvenile justice systems, runaway and homeless youth, LGBTQIA+ individuals, migrant workers, undocumented immigrants. Actually, any minority, I would say, are vulnerable. People with disabilities, physical or psychiatric, so people with mental illness are also especially vulnerable to being exploited. And a history of substance abuse, there's a lot of overlap with trafficking and sexual exploitation and substance use. Unfortunately, so this is an article from the New York Times. Unfortunately, the way that teenagers learn about sex mostly is from online porn or their friends, but it's not a good way to learn about something that should be intimate, private. Usually these pornography sites show sex in a violent, aggressive form. For children, there are lots of predator apps that, especially during COVID, with the children being on the computer a lot, we've warned parents to be very careful, monitor what they're being exposed to, because somebody will pose as a child and say, send me pictures of yourself, I'll show you my private parts, you show me yours, something like that. And the children are just, they don't know, and they're vulnerable. And then that's used for child pornography. So the difference between abuse and trafficking: abuse is usually one or a few perpetrators, a family member, a neighbor, someone who they know. Trafficking, they're strangers. And as the Super Bowl was mentioned, some of those, mostly women, have 20 to 50 sexual encounters a day. Kind of hard to imagine. However, something else that's hard to imagine is that parents may, in fact, engage in selling their children. I've been involved in some cases like that, where they, as children, they're just literally forced to do something. But there's also, even in adults, there's false advertising, and then once the person is essentially raped, violently raped, several times, they're so ashamed and so humiliated, and they feel so weak, they don't feel like they can do anything further. And they kind of get stuck without help. So the reason why I got involved in this is because I had heard that police and judges and lawyers and the U.S. attorney who spoke to me about it, the congresswoman, everyone seemed to be involved in trying to combat trafficking, except for healthcare. And I thought, what better system than medical schools, which are, medicine is respected, it's organized, it's conservative, it has a structure within which to work. So that was how I decided to focus on healthcare. And in fact, I found out that almost 88% of victims while in captivity will have contact with somebody in healthcare. They'll go to the emergency room, or they'll go to a primary care clinic or a family clinic. I mean, they obviously, they don't get good healthcare, and their health is bad, but they still occasionally need some kind of healthcare. So we have contact with them, and so it's incumbent upon people in healthcare to be able to identify a victim or a survivor, and they won't talk about it unless as Dr. Geinesman mentioned, you set the stage. You don't say what's your chief complaint? Why are you here? Instead, you actually, as soon as you kind of get the hint that this is a severely traumatized person who may have been through some very difficult life experiences, or she's in the life, you say, how can I help you? And we're trying to teach medical students to do that, change the way that they approach getting a history. This is just the emergency department sees most of the victims. So here would be a patient example. It's a kind of a composite of many patients, but this is the kind of person you might see in your clinic or emergency department. So I usually ask the class of medical students, what's the first thing you think of? Here's a young woman, 30 years old, female, 3 children living in foster care. First thing you want to ask is, why? Why are her 3 children living in foster care? Well, she also has pelvic pain and depression, and she's suicidal, and she has chronic STDs. And then she has more health problems, unhealed or untreated fractures, concussions, and substance abuse is highly prevalent. And then she may have bruises, and in particular, there's this kind of tattoo. Some surgeons at the hospital contacted me because they had heard about my work with trafficking victims. And they referred a woman to me who they were operating on for an appendicitis. So she came in with an acute abdomen. She had, they diagnosed an appendicitis, and they were ready to operate on her in the operating room. And there was this tattoo, very similar to this, daddy with a date on it, across her abdomen. And they all knew what it meant, but they didn't know what to do. So fortunately, this surgeon did contact me, and I was able to get some resources for her. So we actually, once we had that conference at Cornell and just kind of opened the topic up, people came out of the woodwork, and this internist, actually a hospitalist, said, I'm very interested in this. His name is Joseph Shin. He's very interested in this, and he applied for a grant from the Department of Internal Medicine, which was great, so that we could get different departments to work together on this. And we did some focus groups. We met with survivors who were part of an agency in East Harlem in New York City, and we asked them questions about what were their medical problems. The thing that they complained about the most was physical trauma, but also mental health. And what their experience with healthcare was that it was very fragmented. They felt very stigmatized and disrespected, and there was a high burden on them of disclosing their experience. And the results of our study, which hasn't been published yet, but hopefully we'll get to writing it up so that people can begin to know more about the need for trauma-informed care and a stigma-free environment, and for people to feel safe for patients to feel safe when they're in a healthcare setting. And this is the kind of thing you see with a victim who has been just severely compromised, severely traumatized. Their memory is compromised. They can't give a straight story. In children, it's kind of even worse because their development is derailed. So when you go into medicine and you see a child who is just severely dysregulated, think what kind of trauma this child has been through that hasn't yet been identified. And the most important thing is to build a relationship. If they feel that someone cares about them, that they'll try to respond. This is the kind of trauma-informed care that you have to provide. It was mentioned in that video also, the language, words really matter. So instead of calling them a teen prostitute, which was what they were called for years, instead of a child, this is a commercially sexually exploited child, not a criminal. We wanted to look at the buyer demand, because without buyers, there would not be this kind of trade in commercial sex. And we found that the buyers have some similar problems. They've also been victims of sexual abuse or family violence, or they may have a mental illness. As well as the traffickers or the pimps. This is Ghislaine Maxwell, who actually assisted Jeffrey Epstein, and even Snoop Dogg always said he always dreamed of being a pimp because he thought it meant, money and clothes and whatever he wanted. He's given up on that. There are different kinds of traffickers, and I was thinking about Ghislaine Maxwell. I think she was more like the CEO pimp. For her, it was just a matter of money and procuring young women for Jeffrey and the men who were buying sex. And the traffickers perhaps have even a worse history of brutal violence and neglect. And so success is not a straight line where you intervene, you rescue people, and everything turns out wonderfully. It doesn't. It's more messy, and you go 2 steps forward, 1 step back. Hopefully even that. These are some documentaries that I would recommend watching. Tricked is about the industry in the US. Just the most striking thing for me that I saw was that I learned from that is that there's a pimp ball of the year. It's usually held somewhere in the Midwest, in the U.S., and there are prizes for the pimp that earned the most money and had the biggest stable. So what do you do if you suspect a victim of trafficking? There are resources, there are hotlines. I would encourage you to join HEAL, HEAL, especially, is a health trafficking organization out of Boston. And to kind of get involved. These are groups for survivors, especially male survivors. There are groups for people. And in fact, even the business organizations are getting involved, since it's a lucrative business and it has to do with money. They are looking at, this is from Forbes, they're looking at banking, hotel, travel, social media. And in fact, Delta Airlines, when I last looked, they have a program of training for all of their employees so that they can spot someone who's being trafficked on an airline. So this is the result of advocacy and raising awareness. And so I want to encourage you to do that. You think you can't change culture. It's such an entrenched, and as Congresswoman Maloney said, it's just an under-penalized criminal activity. However, in New York State, they changed the laws between 2016 and 2018. It became a law that that healthcare facilities had to be trained, or it had to be part of their annual hospital training. So for the first time in December of 2020, just a few months ago, it was part of my annual hospital training that there was a section on human trafficking victims, identification and assessment. You have to read a few pages and then take a quiz. I was thrilled. It took a few years. It becomes a law, then the regulations have to be approved. However, it's now, it's definitely mandated for children under the age of 18. The biggest issue is prevention of child abuse, I think, or early intervention. And engagement with victims. The less abuse, the less trauma, the better. And you have to work with community partners, government partners, law enforcement partners. But I think that there is hope for this. And this is the answer to it. We have to be attached to our children. We have to value children. And if you haven't seen this video, just do a Google search for a video of a guy having a conversation with his toddler. It's just great the way they interact. So I will end there, and I hope. Let's see. Okay.
Thank you so much, Dr. Pender. That was,
Questions?
That was immense. So I will open the floor for questions. I'm sure like everybody learned so much just from the presentation, but I'm sure there's some burning questions in the crowd. So I will give the floor to you all.
Hi, yes, I have a question. My name is Ryan. Thank you so much for the presentation. Does the growing cultural acceptability in this country of sex work exacerbate or make trafficking easier? And does border regulation make that easier or harder as well?
So, so I didn't mention sex workers. They are in a somewhat different category. First of all, they're very organized. They have a labor union. I believe they have a labor union that's in the UK. And so they're not enslaved the way these victims are that I've been talking about. However, the ones who I interviewed, and they, you know, every March, the UN puts on a 2-week conference that has to do with the status of women, and the sex workers come, as well as the people talking about trafficking. They come to the UN. And so I had a chance to interview some of the sex workers, and they all had traumatic childhood histories. However, they found a way of kind of, you know, doing something positive with their history. And so they'll go into somebody's home, somebody who's disabled, for example, and you know, and perform sexual services. But they're not exploited. They're not enslaved. So that's a different story. You talked about border. You know, I'm not sure I totally understand this, but when a person is smuggled across a border, it's a crime against the country that is, you know, smuggling them. When a person is being trafficked, you know, that is, they don't know, you know, they were under false circumstances, they were coerced. It's a crime against the person. So the law kind of differentiates those two categories of people. I hope that answered your question.
I think Ryan brings up such a good point, because the many proponents for legalizing sex work, like sex work is work like any other work, like any other employment. I think it makes it safer if, you know, these employees, so to speak, are screened for STDs and they're protected, their labor rights are protected. So I think Ryan brings up a really great point. And there is definitely that distinction.
Yes. I think, you know, they're kind of safe in a way. I'm talking the hundreds of thousands of people who aren't safe, and once you're aware of it, I mean, I see it all the time. I see it everywhere. You know,
Definitely.
happens a lot, and you know, I think, I mean, I didn't mention the you know, the rates of abuse or sexual assault that happens to young women and young men. It's supposedly 1 out of 3 women, 1 out of 6 men. It's probably more than that in men. But so if you think of that, you know, I mean, there's a whole range. So trafficking is, of course, at one end of the spectrum. You know, that's the most severe. But there's a whole range of things that happen to young people.
That's so right.
Yeah, I was reading an article the other day that mentioned that because sex work is so looked down upon and it's illegal in most states. I know Baltimore has now decriminalized it, but there's a lot of people who are acquiring sex work and they don't even know that the individuals that they're having that sex work with are trafficked individuals. And that has a lot to do with the stigma associated with that kind of occupation.
Yeah. I was on a panel once, and somebody, actually a colleague, said, well, you know, I'm treating this man who you know, uses who pays for commercial sex, and you know, what's wrong with that? And so I had a whole list of things that was wrong with it, but the main thing was, you know, including why, you know, why, at least, at the very least, you know, the patient and psychiatrist should know, you know, why that's happening. But maybe the most important thing is that you don't know how old that girl is. You know, they're given growth hormones or other hormones. They're, you know, made up. You don't realize that they may be, you know, 14, 15, and so that's what's wrong with it. Anyone else?
I have a question. So in terms of advocating, where would be a good start, or how do we go about doing that?
It depends on, you know, where you are. Where are you located, for example?
So I'm actually from Houston, Texas, and I'm a USIMG, and I actually rotated in Houston, and I often saw, you know, in the ED, you know, patients that were potentially being trafficked, but there really isn't a system, you know, there in Texas yet. And so for a while I was very, you know, passionate about this topic, and I you know, I want to be more of an advocate, but I don't know where to start.
Okay. So I think, you know, one of the best things that happened to me was that I had other people to work with. So I wasn't doing it by myself, because I think that it's very hard to tackle a subject like this, you know, alone. So I had at least, you know, 2 or 3 other people, like the OBGYN. She was a resident when I was working with her, and you know, so pediatricians. So I would see if you can find out who else is interested in this topic, and if you want, you know, I can try to help you make contact with people. I know that there are people all over the U.S. now who are interested in doing something for victims and survivors, and there are clinics everywhere now. I don't know off the top of my head what's in Houston, but I know, like, I was asked to see somebody in New Orleans, and I found 5 resources for them. You know, Tulane had a bunch of clinics. So there are people you can connect with, and then once you're in that group of other people who are interested in doing something, you kind of work together, and it grows from there. So you just need to make some initial contacts, and I'll try to help you with that if I can.
Okay, thank you. I appreciate that.
Sure. Sure. I think the biggest thing is to raise awareness of it, especially in healthcare systems.
I think it was also interesting that you brought up, Dr. Pender, with the people who might be thinking that they're entering an honest transaction, that actually some of those workers are actually victims of trafficking, and especially with, I think teenagers today look so different from, I mean, I'm still in my 20s, but from when I was a teenager, I think teenagers today look very different. And then they have all this access to social media, all these apps, and then they're being tricked into things that is just far beyond what they were thinking initially. So it's this two-pronged problem, I think. You know, the culture is changing, and then all this access to technology, and these children really don't know how to handle it all. So
Mm-hmm.
So I feel like there's a lot of like different issues as well being posed by this new age.
Absolutely. Absolutely. I mean, I think, you know, it's much easier to talk about this now, like even like the Me Too movement, and you know, all of that, that's in the media and in documentaries. It's easier to talk about. But I mean, children are so vulnerable, you know, they don't know. And it's so destructive to exploit a child for especially for sexual purposes. So destructive to their psyche that you know it at all costs it has to be prevented or at least stopped. And you know, fortunately, there are a lot of people who are working on this. And I think treatment for the buyers is critical, because I think that they are perpetuating the system. At least we have access to them. The traffickers themselves are, you know, a lot of them are like business. You know, they think of it as a business, and it's very lucrative, and we're not going to stop them. But I think, you know, the buyers there could be some intervention there.
Definitely. And it's definitely so like poignant that, you know, these children, I feel that when I'm like on the wards and I'm speaking with kind of victims of sexual crimes, the children don't, their psyches aren't developed enough to fully process what's happened to them. So it's kind of like their response is stunted somewhat, which is appropriate for their age developmentally. And then, you know, as they're aging and maturing, they start to fully comprehend what has happened to them. And it is kind of, I think it's really up to obviously their support network, but also psychiatrists, health providers to kind of halt that spiral into depression, anxiety, and everything that comes from essentially PTSD that comes from that incident. And it's really up to us to kind of halt that as much as possible.
Yes. Yeah. I mean, children always kind of blame themselves for anything that happened. You know, if there's, even if they're abused, you know, they feel like in part, it's their fault. It's very, very difficult for them to be angry with the abuser.
Precisely.
But treatment, you know, therapy, and if they can get to that point. I mean, therapy for a survivor of trafficking, I don't recommend individual therapy. I think it's too complicated. I tried it, and it just doesn't work. You really need a group setting. You know, you need peer support. You need lots of different disciplines. You know, they need a social worker and occupational help, and you know, all kinds of things like that. So so it's not the traditional kind of treatment that you'd offer.
Just off of that, Dr. Pender, I had a question about how kind of earlier in our education and training, if you had any recommendations for resources or things we could do to try to start practicing being better, more trauma-informed practitioners, or even just people that might interface with people that have previously suffered abuse, and how to kind of be aware of that relationship, even if you're not a specialist yet, and how to kind of navigate some of the trauma. That's a large question, I know, but I was just wondering if you had any thoughts.
No, I think, no, it's a very good question. I think that it is possible. The best thing, I guess, is to read about complex trauma. And there's a lot of literature on that. And you don't have to read it in fine detail, but if you just, you know, do a literature search for what the characteristics are of somebody who's who has complex trauma. Because I think what happens to these people is that they're the patient who is deemed, who's labeled, uncooperative, hostile, difficult to manage. And what I tell practitioners is the first thing to think of if you see someone like that is to think about complex trauma, not just the usual PTSD, but just that there's more trauma than a one particular incident, and they need to think differently about this person and think, how are they going to engage with this person? So, like I said, you don't ask, what are you here for? What's your problem? I mean, that's kind of the worst thing to say. Rather, this is a safe place, and how can I help you? What do you need? And they really, it breaks the barrier. And then not to ask them, well, how many Johns did they see, the night before? Things like that, stigmatizing things like that are just antagonistic. So there's, I would read about complex trauma, but the first thing is to keep in mind that when you have a difficult patient, that this may be what's been going on in their lives.
Thank you. I had a slight follow-up question, which is a little bit of a deviation, but I was just wondering if you could speak to your experience with the UN and kind of what your role is on that part of your career and how you found yourself there.
Sure. Well, I'm in New York City, so that made it easier to just go over, and before COVID, to just go over to conferences there. And I've always been interested in kind of global health and global mental health, and I feel like what happens here in the U.S. or in New York is relevant to what's happening all over the world. And so I started attending conferences and started speaking to people, and then I joined the NGO Committee on the Status of Women. And if you look that up, they have a great website. It's a coalition. It's a coalition of NGOs. So there are a few of them. There's the NGO Committee on the Status of Women. There's the NGO Committee on Mental Health. There's an NGO Committee on Migration. There's an NGO Committee on UNICEF and and children. So we're not government people. We're not in the government. So we're non-governmental. But our area is education and advocacy, and they're always looking for people who are interested. So you can join one of those coalitions of NGOs. The American Psychiatric Association is an NGO of the UN as an individual NGO, but then with that status, we join these other coalitions, and then we have a voice. And then I just kept raising my hand and and talking and saying, well, okay, these women are getting systematically raped, and I know you're worried about their physical ability to have children later on, but what about the psychological consequences? And they said, oh yes, you're right, tell us more. And just from there, I just worked my way up and learned a lot about dialogue and being able to talk to people, and and lobby them and convince them to do the right thing. So we don't make laws. I mean, I don't make any laws, but I certainly can, like they do at the UN, can educate people and just encourage them to do what's right and good, and so I've just stayed involved, and I the best entry is through those NGO committees.
Thank you, Dr. Pender. That was very helpful.
Sure.
And very exciting to hear about all the different avenues that it's possible to kind of get involved. They recently at my medical school in Rochester started the medical student psychiatric asylum seeking evaluation. So I've had the privilege of being able to participate in a couple of those. And it's so exciting to see some of these initiatives start and how the field will grow, hopefully. And it's great to hear your perspective about advocacy. So thank you for sharing.
Yes, thank you. Thank you for your interest. I mean, it's really, it's up to you people to take the baton and keep on going with it. And one person or a few people, if you have the passion and the perseverance and don't give up, you can make a lot of changes. I mean, I was just amazed that this New York State law came about that now mandates every healthcare facility in the state of New York. I don't know how many hundreds of thousands of people. I mean, I know New York Presbyterian has about, 45,000 employees, and they all have to take that training. So now they get to, there's, what do you do in case of a fire? What are you doing in case of a armed invader? And then what do you do in case of trafficking? And I'm sure a lot of people looked at that and thought, whoa, what's this all about? But that's great. So, it does work if you have a particular interest in something and you keep on advocating for it and you persevere, even if you get a little pushback. I mean, I applied for a $6 million grant to identify and train healthcare on trafficking victims. So it included community agencies, and it even included some housing for them. That's why it was $6 million, and it got rejected. So what? Just little setback. I put a lot of work into it, but I met a lot of people, a lot of new people that wanted to partner, and I just keep on going, So I hope you will. Anything else?
I think it's also great that it's kind of something that if we're interested in, we can jump in and do as much as we desire and can. As Dr. Avery was saying before, it doesn't matter if you've done a fellowship in addiction medicine or not. Like, we owe it to our patients to all be a provider of addiction medicine in one way or another. So it's great that you carry this message and you inspire us to do as much as we can to help our patients.
Yes. Psychiatry, I was talking to somebody yesterday about this. Psychiatry, psychiatrists take care of actually the whole person. It's a good thing to remember. We do a lot of primary care, at least making sure that their primary care, their medical care is taken care of, and that they're getting their vaccinations and physicals and and all of that. And I think it's the best specialty for taking care of the whole person. So we carry them with us, and their whole lives and everything that happens to them. So it's a great specialty. I love it.
Yeah, I wholeheartedly agree. I mean, I'm biased, but
Me too. Obviously.
All right, folks, do you have any more questions for Dr. Pender? Covered everything. Okay, well, Dr. Pender, thank you so much for joining us and dedicating over an hour of your Saturday to inspiring and educating us all. I think I could speak for everyone when we say that was incredibly entertaining as well enriching. I think it's important that we try to broaden our horizons as budding psychiatrists, especially in a time when everything has gone virtual and maybe it feels like a lot of our opportunities are stunted in one way or another. So we really appreciate you donating the gift of your time.
No, I appreciate the opportunity to speak. I never say no when that's another thing. When somebody asks you to do something, you say yes. You only regret the things you didn't do. So somebody invites you to do something, you say yes, and that's kind of something that I live by, and so I appreciate that you're spending your Saturday here to listen to us, and for organizing this. Thank you so much.
Well, thank you so much. The pleasure was all mine.
Have a good rest of the day.
All right, take care, Dr. Pender.
Bye.
Okay, everyone. So the time is now 1:22 p.m. EST. We have about an hour for lunch, so I think we're going to resume at 2:30 p.m. EST. You guys are free to log on beforehand, but we're probably going to be setting up with NAMI and the next session, which is called In Our Own Voice. So I'll see you all back at 2:30.